Hi, everyone. Welcome to our panel. My name is Emma Asante, and I'll be leading our discussion today. And thank you for joining us for Barriers to Basic Needs, what we're seeing, what we're doing, and how you can help. And we have a great conversation with some dynamic women. But first, before we get rolling, I wanted to just start things off with a few housekeeping things. This webinar will be recorded and it will be shared. You can share it after the event. So if there's something that you hear and you don't have a pen close by, don't worry, you can just go back and watch it, no big deal. The audience should be able to see all of us. There should be 4 boxes on the screen, kind of like Brady Bunch, but not really. But we can't see you. I know there is more than 250 of you out there who are watching from your laptops or your phones, so thank you for joining us. You are muted, so if the dog barks or the kids get loud, it's okay, we can't hear you, but you can see us. If you have a question, if you hear something, you have a question, please use that question box and send it in to us. And later in the program, we'll get to hear what's on your mind. And finally, if you're having technical difficulties, use that question box and the Cradles to Crayons team will be able to assist you. We'll get you up and running as quick as we can. All right, so let's hear from our panelists. Let me introduce them first. So Shoshana Buchholz-Miller, wave, so we know who you are. Hey there. Shoshana is the executive director of Cradles to Crayons Chicago. She spent her career working to address pressing social and human rights issues and to inspire others to do the same. We're going to get to hear a lot more from Shoshana, and thank you to Cradles to Crayons for this opportunity for all of us to be here. Kate Maehr, wave Kate. Hello, Kate. Has led the Greater Chicago Food Depository in its mission to provide food for hungry people while striving to end hunger in our community since 2006. In this role, she has guided a number of strategic initiatives and accomplishments to distribute nutritious food across Cook County while addressing the root causes of hunger. And of course, she's been very busy lately, and we'll get a chance to hear from her. Candace Moore, welcome, Candace. Upon taking office, Chicago's new mayor, Lori Lightfoot, appointed Candace Moore to serve as the city's first chief equity officer. Charged with leading the new Office of Equity and Racial Justice, Candace has been tasked with advancing policies and practices that promote equitable outcomes across city services and resources. So thank you all. Really looking forward to talking to you. And while I was preparing for this, I took a second to kind of close my eyes and think back to where I was on New Year's Eve, right? So, everyone in New York, all my friends on the East Coast, the ball dropped, and I'm getting the text early, it's 11 o'clock here, right? Midnight happens, Happy New Year, clinks champagne, and off we go to 2020. And here we are, not very much far. And I was thinking back, the Emma back then did not know what was going to happen. What's happened now, right? The Chicago back then is a different Chicago than we have right now. And so you all have been working to make change and to make our situation better in the midst of this epidemic. And I wanted to start by asking the question, how has your work changed over the past couple of months as a result of the COVID-19 crisis? And I'd like to start with you, Kate. Of course, the Food Depository, you are kind of front and center. The need is great in what you do. So tell us about how things are going.
Thank you, Emma. And let me just, to Shoshana and to everyone at Cradles to Crayons, such a great thing to be able to come together. And so thank you for making this possible. In so many ways, our work is so different, and in some heartbreaking ways, our work is incredibly consistent with what we did before. New Year's Eve, the same New Year's Eve you were talking about, the Greater Chicago Food Depository was serving 812,000 people in Cook County. And I think it's important to start there, because in a period of time that I suspect that we will look back at and think of as the best of times, for way too many individuals and families in our community, they were struggling with access to the most basic of needs, food. And so that as a background, what we have seen since then has been an absolutely seismic growth in need. As of last week, the partners in our network, we have about 700 community-based partners that we work with every day, are reporting a 70% increase in the number of individuals turning to them for food. So the need has risen dramatically, but at the same time, we have had to absolutely redesign the way we do our work, re-engineer our volunteer engagement programs, manage a supply chain that has been absolutely chaotic, and do it all while maintaining social distancing and safe practices. So it has been unlike anything any of us have ever seen.
Wow. Shoshana, what are you seeing that's different?
So our stories, Kate and my stories are similar. So we last year, our fiscal year ends at the end of March, and in that year, it's a pretty good indicator of what normal used to be, and we served over 100,000 children. So we know that those children needed this support before the crisis. And to be frank, we're a new organization. We've only been around 3.5 years. We know that there are more kids who could have used our services. And so we've always been trying to grow and try to meet more need. But we too have seen a dramatic increase in the need that is coming toward to us. We work with 54 agency partners, and we continue to work with them, but we have expanded the partners and have worked with new partners because so many groups are reaching out to us that have families who are in need. The diaper, so we're supplying the most basic of needs right now, like Kate, with diapers, wipes, hygiene supplies. Normally we provide a lot more than that, but we're really not able to right now. But even with the diapers, we've seen across our network about a 300% increase in diaper demand year on year. So that just shows you, diapers are very expensive, and similar, as Kate mentioned, the supply chain has been complicated. And so people are having trouble getting it themselves, and we too had to manage some challenges that way as well. So, and we currently are not taking volunteers, and kudos to Kate and her team for continuing to do so. We hope to bring those back in the near future, but we also are trying to navigate the challenges of social distancing and the structures that we had previously.
Have the people who you are helping, has the demographic or the type of people changed from before pandemic to now?
I think for us, and I'd be interested to hear what Kate has to say, it's just that the volume has increased dramatically, but a lot of, the people who needed our support before still need it, and probably need it even more. And then in addition, there are more people on top of that who need it. I don't know that our demographics have changed, but I will say that we serve all of Chicagoland, and we have had significant need in the suburbs in a way that we don't always serve it as well as the city.
Same question for you, Kate.
And I would have a similar answer. I think, we have seen people who are brand new to the system, who are sharing stories of, and frankly, a really bewildered state. They found themselves, they woke up one day and they had nothing. And they are first-time users to our system, and they're coming from neighborhoods that you would think of as being affluent communities. We also have a lot of people who have been struggling, and I think it's important to talk about that. There are so many families who have been employed but didn't have enough income to make ends meet, who now losing hours in a job or losing a job altogether, they've been food insecure, and now it just deepens that financial insecurity and the food insecurity that goes along with it.
Candace, talk to me about, you're with the mayor's office, and of course, there's so much going on right now, especially in your realm. And when we look at the African American community and the Latinx community, which is now surged in the caseload. Talk to me about the disproportionate high numbers in those communities and how the mayor's office is addressing that, especially when you look at the essential workers. Many of the essential workers are in the Black and Brown communities. How are you all addressing that?
Yeah, I mean, I was reflecting on this theme of like, what were we doing before kind of COVID-19 and what are we doing now? And sort of in answering that question, I think what we were trying to do before COVID-19 is address the racialized inequities that existed across Chicago, and really take a much more robust systemic approach to it as a city government. And what we are doing that is kind of 10 times sped up right now. Right before COVID really hit, we had a poverty summit in February, where we were beginning to lay out both a charge for this city to confront and tackle poverty head on, for us to co-create this with our community, and for us to really get out there and try to change the map of Chicago. I think what's interesting about COVID is that whereas a virus doesn't discriminate, it lays pretty perfectly on that same map of inequity and causes different and deeper impact and outcomes in certain communities. And this is what we are seeing when it comes to the African American community, with the Latino community, the challenges that we have in terms of what COVID is producing lays perfectly on top of the map of inequity that exists in Chicago. And so in some ways, our charge has not changed. We still are dedicated and have to focus on changing the map. But for lack of better words, with some fire under us, right? With some, we thought we had a call to action, of a sense of urgency before. This moment has sort of added the gas, and we've been called to move faster, further, deeper. And so in trying to address this, though, I think one thing is still true, that before COVID as it is now, the solutions lie in our ability to co-create with our communities. And that's been a core tenet of our approach, is that we at City Hall do not, I don't know, this might be a news alert, don't know all the answers. But the only, in a crisis, in a pandemic, that's called, out a whole lot more. And the only way we're going to get to figuring out what is right in this particular moment to try to drive at some of the results that we need is when we get proximate with our communities, we start building together, we start listening a lot closer about where to apply resources. We build strategies that allow for them to engage and co-create and bring their ideas to the table. And so in some ways, I think this is calling out our need to listen closer, be much more responsive, be more iterative, calling it out in a bigger, bolder way. And I think our challenge is to not contextualize this to a moment, but really to learn from this and start to build out in our recovery and whatever else sort of lies beyond, so that we're not faced with the same sort of challenge for whatever else may lie ahead for us.
What do you think are the underlying causes and factors that have contributed to this situation that we're in right now? I know you talked about how, you kind of had, all three of you talked about how this all kind of existed beforehand. How did we get here? And Candace, I'll start with you.
Yeah, so one, I think the challenges are around the inequities that exist in our healthcare systems, and quite frankly, in our environments that perpetuate underlying health conditions. So we had named and talked about how in some communities there's a 30-year life expectancy gap. And so here you have a virus where if you have an underlying condition, you are more vulnerable. We know that there are certain members of our communities that are more prone to diabetes, that are more prone to asthma, that are more prone to those underlying conditions that make it even more vulnerable or make them more vulnerable to having extreme outcomes when it comes to COVID. Additionally, in a time in which a big part of our public health strategy is to stay home and save lives. I mean, you spoke to this earlier. There are communities where they are the backbone to the essential workforce. And so the option to stay home is not there. They still are helping to fuel our food industries, to really keep our city running, and being exposed in many ways to congregate settings that can become sort of feasting grounds, I think, for the virus. So what stay home, save lives means in that context is very different. And these are the things that we've had to grapple with. It's not that our overall public health strategy is wrong. We know that, prevention is going to be a big key to this, but we really have to think about what are the resources, what are the strategies that we need to put in play for the realities of certain communities, especially if you live in a multi-generational home. What does it mean to try to take care of grandma, mother, et cetera, in a moment in which care cannot look like person-to-person touch. So these are I think the many things that are calling for us to think deeper and to strategize differently in order to sort of better support our communities.
Shoshana, do you think that this situation, this whole pandemic is going to change how you do things after things are under control? And I'm not even going to say go back to normal, because I'm not sure if we'll get back to the normal we had before. I mean, we hope. But how do you think it's going to change things as you go forward? Or have things already changed for you?
Right. So I can answer that I'll start with the Cradles perspective on it, that yes, of course, things have changed. Many parts of the model that we rely on, donated product and volunteers, are temporarily paused. And I imagine that we will, in the short term, have to make changes to those to adjust them in terms of the volunteers we rely on and the numbers and the kind of product we can take in. We're also looking as an organization to think, what more can we do digitally? And I think a lot of organizations are doing that. And we're here on this webinar, which we never had before. So there's that benefit. But I think
in our homes,
but I think, we're also working with organizations. So I think one of the things that has been so crucial, and to relate to what Candace had to say, is this kind of network of organizations that are really interlinked, that we have relied on as our partners. The only way we can serve the families that we serve is to have a network of partners that are already working with families, and then we can provide additional supports so that those families have these basic needs and are also getting additional services. And I think that has been crucial to our model, and that has been so crucial during this period. And part of the reason that we've been able to reach 25,000 kids in the past 9 weeks is because we have these partners. And so I think that these partnerships will be deeper, and there will be more of them, that we have expanded those partnerships just in this short period of time. And I think we see the incredible importance of them. I guess I'd also say that I hope we'll be different. I hope we as an organization will be different, but we as a society will be different. Like, one of the things that keeps me going during all of this is that I think it's a time for change. It's really I want to take an opportunity from something that's very dark and be able to make our society more equitable, and to be able to, people are much more aware these days about the inequities around them, and I don't want to lose that opportunity. And I think it's on us and people on the panel and the people who are on the call to hold on to that. And so that's kind of a bigger change that I hope that we can see in the work that we're doing going forward.
How about you, Kate?
I would say similarly, I think some of the tactics will change. I think we'll see more digital tools and some of the tools that we use and the way that we come into conversations may change. But I think I want to go back to something that Candace said, that I think in many ways the strategies remain the same. They are times 10. They're super turbocharged. But for us, thinking about health and nutrition and the intersection between hunger and health, thinking about equity and what a just society really looks like and what food justice looks like, thinking about advocacy. At the end of the day, as great as I think we are, we need to lift our voices and change the way this world is, because the world does not need larger food banks with longer lines of cars of people getting food. We need people to have stability. And you don't do that through managing supply chains. You do that through advocacy. And I just think it takes on deeper significance and meaning at a time like this. And then finally, this notion of co-creation and partnership. And I think that all of those have been strategies and values that we hold. They will continue to be, but they just take on deeper importance and significance now.
That term, that co-creation term, is kind of stuck with me, that you brought up, Candace, and we talk, about collaboration. That has also been mentioned. And I know that we're stronger together, right? And so I know that, working with the nonprofits and those who are watching, you have funders, you have volunteers, we all work together. Do you think that we have enough collaboration to move forward even more? Do we need more? Do we have the infrastructure in place to be able to take on more collaboration? And I'm not even just saying nonprofits, but nonprofits and government. I work in media, do we have enough? Candace.
Yeah, that's an interesting question. I think, one of the first things that popped into my head is that I think if we still face challenges, then we probably don't have enough collaboration, or we haven't figured it out. There's still room for. So to the extent that there are still these big global challenges that we're all facing, there's certainly room to grow, to get smarter, to think more creatively, to push further, etc. That said, I know there's a ton of collaboration happening as well. And so there's a ton of people owning parts of the problem and stepping up to the challenge, whether formally deputized or just called and motivated. And so I don't know that it's necessarily we need, so I think there is certainly room for us to get smarter, to grow faster, to do more work, to expand our tables. And at the same time, there's still, we have to think about the ways in which we support folks' capacity to lead in some of these spaces, how we step up and step back. Just because we are the convener doesn't mean we always have to convene on every single thing. What does it mean to co-create, to recognize the places in which you have privilege to maybe help support a table, but it's not necessarily your role or your highest and best use to lead that table, and sort of get smart and get perspective about all of these things. I know we've been, and that's a challenging thing to say coming from government too. I think it's partially because I haven't always worked in government. But I mean, I think an example is, we've had these moments where we're like, okay, we need to educate and get more information out to the community on X. And we have a good sense of what all the tools we can get together for that are. But how about we put it in front of representatives of that community before we press go? and they react and tell us, okay, you need to change this. How about you think about this? What about you add this? And I will say from some of the experiences that we've had, those have been the best parts of what we've created, right? Like the bones were solid, sure, but what made it special, what made it relevant, what made it meaningful for the group that we were trying to engage with is that there was another layer of collaboration, another layer of partnership there that really kind of stepped up and met something that was beyond, I think, our imaginations, beyond the perspectives that were already at the table. And so, so I think the answer is generally yes. I think there's lots of room for us to grow here on big challenges that we have.
Kate?
Can I just want to call out, I have to say, I think there's always room for more collaboration, but I have been so proud of the collaboration that has happened. And in particular, I just want to call out the city and the mayor and her leadership. You know, from our perspective, even before the crisis was officially called, the mayor's office and the Office of Emergency Management and Communication was reaching out proactively and engaging partners and asking them to come to the table to be a part of creating solutions. And there has been incredible leadership and flexibility and strength and creativity. And I just, as I see the work unfold, I see these values coming forward. And there has been a spirit of collaboration unlike anything I've seen during my time as leader of the Food Depository, and it makes me so proud. And you know, I'm sure we can all reflect on things that we would do a little bit differently during the day, but the way that our public and private partners are coming together in this moment, and it's also the corporate sector, the foundation community, people are collaborating in new and creative ways, and we need to celebrate that. And we also need to think about how do we carry that forward and not let it just be something that is in response to a crisis.
So true. I want to ask a question about advocacy and policy. Kate, does your organization, do you engage in policy and advocacy, and tell us a little bit about how that works?
We do. We have a big policy team, and I would tell you that I think our advocacy work is the most important work that we do. And it's not to say that putting food on trucks and getting that food into communities doesn't matter. But at the end of the day, we have to talk about the safety net. And I'll focus in particular. Our team has spent a lot of time over the last 8 weeks working with our colleagues in Congress to strengthen the programs in the federal safety net, and also to get flexibility in those programs so that people can really easily access the support that's so critical right now. And as much as I love what food banks do, for every meal that a food bank provides in this country, the food stamp program or SNAP program provides about 9. It's critical. And it also happens to be a program that is under attack constantly in Washington, D.C., and it requires us to stand up and talk honestly about the program and how vital it is and how effective it is and why we need it more than anything, and that is advocacy. So we spend a lot of time training partners in the community. Had we not, in fact, literally, had we not had a pandemic, right now I would be with about 300 of our trained advocates in Springfield for our lobby day. Next year we'll be there. It's an essential part of our work.
Shoshana, Cradles to Crayons, has that been involved in advocacy work, and how do you see, if so, how do you see it changing post-pandemic?
I think this is an area that's really evolving for us. So as I mentioned, we have been in Chicagoland for a short period of time, for just over 3 years. We as an organization have been around and have been working in Massachusetts and in Pennsylvania. And so our advocacy, that the issues that we've worked on have been more so on the East Coast and are moving here. I think one thing that is very much on our minds is the fact that in Illinois, certainly, there is really no state or federal help for people who need the necessities of clothing. Like there's just that falls to us or to others to provide that. And we call it clothing insecurity. So we identify that if you don't have access to appropriate, adequate, and affordable clothing, you are clothing insecure, and that has deleterious effects on children. And we focus on children from 0 to 12. And so if you want support related to that, you have to find it from an outside resource like us. And in addition, diapers, which are very present in terms of issues right now, they're extremely expensive, and there isn't support for that in many cases. And so we know that there are movements at the federal level in terms of diaper support through the National Diaper Bank, which we're a part of, that is trying to get diapers to have some sort of financial support for people in need who have diapers. But we also want to explore what other supports we can get for people who have other insecurities like clothing insecurity. And so I think those issues, just like Kate said, it can't just be something that we talk about now when we're in a crisis, but it's something that we need to be looking at in the long term and how we can address it, and really making people understand that the need even exists.
And Candace, you are in government, and so when we talk about advocacy, and you at the first time as the chief equity officer for the city of Chicago, we've never had one before. Such an extraordinary time to have that role. How do you see things changing from maybe when you were appointed by the mayor to now maybe your plan shifting now that we are hopefully soon we'll be coming out of the situation of the pandemic?
Yeah, I mean, one of the things that I was trying to build, like right from the outset, and I think in some ways, or I should say, I think the work still continues, is to build the capacity of government to sort of think about equity as it designs and develops policy and strategy. One of the things I say is equity is not a destination. There's not a specific point in time in which we get to equity. Equity is a muscle, and we practice it. We do it every single day, and the more and more we practice it, the stronger we are at it. And the minute we stop is when we lose the gains that we've had. So equity is about how we do business, and that is certainly at play in terms of policy. There are questions and considerations that we must ask as we make critical decisions about resources, about I'm trying to think of the word, resources, and like the kind of the rules of the game in terms of how we sort of operate as a city. And we have to recognize that one size often does not fit all. And if our goal is a collective one, that's about trying to build a healthy city, to build a city that we're all proud of, that means that we may need to exercise with precision to really support certain areas of our community getting to that overall goal. And so I think this is where advocates can be really important to government, to push, to raise, to identify, to highlight, to slow down, to speed up, all of those things, because when you are in it, there are so many moving parts. There are so many aspects of it that I think folks who are trying to do good work are often set up with tons of blind spots. when you are trying to think about something that can be constructed to serve a large swath of folks, there are places in which you may not be spending enough time thinking about a particular subset of folks or the way this may play out within a certain reality. And I think that, so that relationship between advocates and government is critical to really drive, not always comfortable, but critical to really drive at more equitable results. And part of it is as government finding the place and grace often to sort of own that moment and say, okay, what can we do differently? How can we expand? How can we think more creatively? How can we push a little bit further? But I do think that work continues.
Yeah, no, I would hope, just in my thinking, you know, I would hope that after this is over, that there is some sort of post discussion around this, you know, because I feel like there are so many learnings that we all have learned in different corners and in our part of the pandemic that we're tackling. I think we've learned so many different things, and Chicago is so great at collaborating. I think we definitely are good at learning from each other. So it's great what you all are doing. I know that this pandemic is huge. You know, we all are tackling it from our corner, but I wonder if we could just take a moment and maybe share a personal story, a story that kind of brings it home. If, you know, you all are deep in it, you're every day in the mix. But maybe I'll start with Kate. Is there a particular story that you think kind of brings it home to kind of explain what is happening out there? You know, we're talking about, you know, what are the barriers, what are we seeing, what are we doing, and how you can help, the name of the panel. Is there a story that kind of explains that?
You know, I love that question. Somebody who is one of my absolute heroes, an artist and businesswoman, Monica Haslip, always talks about the fact that the closest connection point for two people is a story. And I think in this moment that we're in, we're all getting hit with these really big numbers. And it's hard to understand millions of unemployment claims and hundreds of thousands of people sick and tens of thousands of people dying. And I think it's so important in the face of all of that for us to humanize what's happening. And so every day our team is out trying to share the stories of people that we're meeting, because these aren't numbers. These aren't tick marks on a graph. These are humans who are our neighbors. And I think it's really important to share that. So I will just share, last week, I was out at a distribution that we were doing in partnership with a faith organization in the Woodlawn community. And as typical, I had sort of gotten there with 30 seconds to spare, and I sort of was there to thank the food depository team and the volunteers who were at the site, the partners who had come out to support the work, and probably because I was, you know, wandering around looking a little lost, one of the volunteer leads from the church said, "Why don't you volunteer and help hand out food from this table over here?" And so I went and did the job that I was assigned to do. And the way that the distribution was working, cars were pulling up, and we were asking individuals whether they wanted to have the food put in their trunk or in the back seat. And so the car pulled up in front of me, and there was a woman, and she looked tired, and she explained that her trunk didn't work, and could we please put the food in the back seat. And so I opened the back door, and in her back seat there were two kids, and I'm the mom of two kids, and I could just sort of see it all. There was a little boy whose face was buried in a book, and there was a little girl wearing a princess costume, and you just knew that her mom didn't have it in her to argue to, no, you're not wearing the princess costume. And I put the food on the floor of the car and closed the door and was getting ready to step back. And the mom reached out and she grabbed my arm, which in and of itself, in this moment when we are trying to do this work without contact, that is hard because we're missing the emotion and the ability to touch each other. And she looked at me and she apologized. And I must have, you know, with my mask on and my eyes, I must have looked kind of startled. And she apologized again. She said, "I'm so sorry." And then she said, "But we really need this. Thank you." And I just, the parents and the individuals who, on what must be the most painful day of their lives, make the heroic decision to get food and other supports that they need for their children. That is heroic. And if there's one thing that I want us to take away from this, is that our neighbors are doing heroic things every day, and too often we demonize what we believe to be the circumstances of why someone needs assistance, and we elevate it into political rhetoric, when really it is about human beings who need something as basic as food and our ability to provide that.
Wow. Wow, so many times, you use the word heroic. And you're right, a lot of times we don't really think of it in that way, right? So thank you for sharing.
Or we think about ourselves as being the heroes. And there are lots of amazing organizations and lots of amazing volunteers, but the real heroes are people who have been struggling and who continue to have to figure out every day how to make ends meet and are putting the health and well-being of their children in front of themselves. They're the real heroes here.
Thank you. Thank you. Shoshana, I didn't know if you wanted to chime in.
I mean, I think that, every day we're faced with a similar situation. One of my colleagues talked about, we received something like 300,000 diapers, a delivery of 300,000 diapers, which is a lot of diapers and a lot of boxes. And so it falls to us to kind of pull them around with our, pallet jacks in the warehouse and ultimately get them out of hands. And sometimes it just feels like a lot of boxes. But it's really important for us to remember that it's not boxes, that when we're delivering 300 boxes of diapers, that's, 12,000 diapers, that is going to 300 families and to 300 children or more than that. And so we do try to hold on to these stories. So one that I can think of, we have a wonderful partnership with the YMCA. And during this period, in addition to providing the diapers and the wipes and the other things, we have provided some clothing. And the YMCA had reached out to us about a woman named Melody and her son, who is Joseph, who is 2. And they were working with her because her son had been going to the child care center at the Y. And she was very involved and is very involved, always comes to the parent meetings. They have like training sessions for parents as well. And she attends them and she's really engaged. And she lost her job at the beginning of the COVID crisis. She was a data analyst and she was let go. And it became clear to them that she was really anxious about not being able to provide for her son. He's 2, he's growing, she didn't have an income coming in, and she wasn't sure how she was gonna get new clothes for him or he was gonna be at home, so he needed books. So we were able to get a pack to him and provide the books and the shoes and and the clothing so that, you know, as he grows, he has something to wear, and it's a weight off of her shoulders, that it's one less thing that she has to worry about paying for, because there are all the other expenses she has to worry about paying for. And so I think about Melody and Joseph when I think about the boxes, and I think about loading a truck and knowing that it's more than just boxes, it's humans with names. But I also think, to Kate's point, what's really important is I tell the story, and I tell the story about it happening during COVID, and she lost her job, and we can all understand that. But I could have told you that story 6 months ago, and she still would have been as deserving. And, you know, we need to understand that too, that this is not just a COVID response, although that heightens it, and there's so many more people who need us, but this need was there. And there are so many Melodies out there who, through no fault of their own, really have to have really rely on additional services just to strengthen them and their families. And that's what we're here for. And so we shouldn't be demonizing them. As Kate said, we need to be acknowledging that really there, but for the grace of God. And I would hope that we could all rely on each other to get through this like we have been now. I would like us to maintain this going forward when COVID is over.
Yes, thank you. Thank you. And I see that our people who are watching, our viewers, are actually sending in some questions. So I'm just gonna switch gears a little bit and hear what some of you at home are sharing. Here, a question that has come in here is, what are the barriers are the hardest to reach communities to experiencing to access to support? How is the food bank, Cradles of Crayon, and the city helping folks overcome those barriers? Candace, did you want to tackle that?
Can you say the question again?
Sure, no problem. What are the barriers to reaching communities that are in need of accessing support?
I think there's a host of them, and the more we learn and engage, we continue to sort of see different things. One of the things I'll name in particular that we've been doing a lot of thinking about is sort of the digital divide. In this moment where we cannot be physically connected, we have relied on the internet as a lifeline in a lot of ways, not just for how we will educate our kids, but for our social connection to other people, for information about resources, about where to go, updates, all sorts of things. And in a world in which so much of what we are trying to do is put those things online to service the needs of our city, the barrier it creates for those who just don't have access or don't have good access. And some of the supports that we would normally have, like our libraries, are not available at this time. And so it has struck me, and I think, and I'm sure others would agree, just how fundamental of an infrastructure that is to our world. I mean, we are certainly working to address it and solve. It's not an easy problem. It's very complicated. Somebody was trying to explain to me all these different things around mesh networking, yada, 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 way more than I care to know. But just how something that I think I take for granted, maybe sometimes I even get annoyed with, right? Like I want to get offline, but how much of it is a lifeline. And I think when you don't have access to it, it does produce such a barrier for folks.
We have another. Oh, go ahead.
I was just going to add, I think the digital divide is a huge issue. I would also say that language, and also in the Latino community, there still is so much, when we think back to 2 years ago and some of the rhetoric coming out of the White House around immigration, there are so many communities where people are fearful of accessing services. And I think that is a huge barrier that we have to work collectively to find trusted partners who can co-create the strategies. It's not always government. Sometimes government isn't seen as the trusted source, not because the people who work in government aren't great, but because there have been other circumstances that lead people to worry. And so we have to co-create with trusted partners. And that is different for every community, and it takes a lot of time, but it's the only way we're going to be able to really accomplish the work that we need to accomplish.
You know, that is so true when you talk about the Latinx community. In my role at NBC5 and with Telemundo Chicago, that is one of the things that we hear from our Hispanic viewers. You know, when, you know, yes, there's groceries available, you can go pick them up or whatever the resources are, but do you have to give information? You know, that's a scary thing for some communities. And we talk about those trusted partners to reassure them that it's okay. You know, for you to get that help. It makes all the difference in the world. So I definitely hear you on that. And this other question talks about digital as well, since we're on that topic. One of the things I've noticed about the current crisis is that everyone is looking for ways to help. Beyond donating, is there any way for volunteers to help with while respecting the shelter-in-place orders? Is there a framework for organizations like Cradles to Crayons or the Greater Chicago Food Depository to have digital volunteering? Let's see, I don't know.
Yeah, I mean, I can start. Kate can chime in.
Okay,
So this has been a challenge for us, certainly, and we have experimented with some digital volunteering. One of the things that we provide are backpacks for back to school. So we have a Ready for Learning initiative. We will be supplying, as we have in years past, 50,000 backpacks to kids in Chicagoland. And at this, normally we call the program Ready for School. This year it'll be Ready for Learning, because we don't know what school is going to look like, but we know that the kids that we serve are going to need these supplies for learning. And one of the things we put in those backpacks are well-wish notes. So a note of encouragement from usually our volunteers who are coming to our warehouse and work in the Giving Factory. So right now we have been providing folks with well-wish note templates, and they can create those at home and send them to us, and we can distribute them in the backpacks that we will be distributing. It's a small thing, but it's something that we've been doing. We also will be shortly putting out some information about cleaning out your closets, because we do anticipate a world in which we can collect used items again, and we hope it's not too far away. And so that's another way that's very important to us, because we use these gently used items and we want to give people some guidelines about that. And we hope to welcome volunteers in the not too distant future, but I know that Kate is already doing that. So I'm interested to hear about that too.
Yeah, we were, and I just credit to Governor Pritzker and really credit to Deputy Governor Sol Flores. When the stay-at-home order went in place in Illinois, food banks, their volunteers, and food pantries and their volunteers were all excluded. And in fact, there has been a lot of support for helping us connect and engage and grow our volunteer base, because we desperately need volunteers. So every day at the food depository, we have volunteers coming in and packing food boxes. Among the challenges that we had in that first week of the stay-at-home order was completely re-engineering our volunteer process so that we could adhere to safe distancing. And so it looks, if you volunteered at the food depository a year ago, it looks completely different. And we also have volunteers who are going out to community sites. I was at a distribution this morning where there were 50 volunteers, again, set up so that there's no contact, and volunteers and clients in need of food are staying far apart, but we need volunteers out at these sites. So we're excited that people are answering the call, and we are filling up most of our volunteer sessions, which is a great thing. Beyond that, I'll go back to advocacy and say that right now, in particular this week, we are really asking people who are advocates, and we'll set a broad, big table. We'd like everyone to be an advocate, can go and sign up on our advocacy center at the Food Depository's website. And through that, you can be directed to send emails and make phone calls to members of Congress. There is an incredibly important piece of legislation that just passed the House that will be going to the Senate that will significantly strengthen the food stamp program. And we need people to speak up, to reach out, to lift their voice, to advocate for the support that we know our neighbors need.
Thank you. It sounds like it's definitely a way that those who are watching can help your organization right now. Candace, with everyone that's watching from across the city and in the suburbs even, how can we help in what you're trying to do and helping our community through this COVID-19 crisis?
Yeah, so I think one of the things that I've really been heartened by is the partnerships between communities and government to really try to drive at solutions. So I'm thinking about Rogers Park in particular. They really organized a sort of neighborhood effort of sort of having a hotline in which folks could call to get information about resources. They partnered with the alderman's office, and the alderman was really instrumental in sort of working with that, with this sort of community network. I don't want to say their name because I'm going to mess it up because I can't remember exactly, but they built this really robust system of care and concern where folks can articulate needs and other folks call in and say, hey, I can help out there, whether it's picking up groceries for someone and dropping them off, in a place where someone can grab them, whether it's helping people identify resources, all sorts of things. I think, it is beautiful, and they are just an example of the many mutual aid structures and networks that have been that have risen up to meet needs across communities. So I think certainly I can name several in Chicago that I think people could plug into. But I think the other thing that I've just been humbled by is that people didn't wait on government a lot of times. They didn't have the luxury. And that's not to say government doesn't need to be a partner or doesn't even want to be a partner, but I've been absolutely inspired by folks asking themselves and their neighbors, what do we have? What can we do? And what is the need? And how can we organize ourselves to start to meet the needs of our community members? And so I think many folks can do that, whether it's doing wellness checks, having a group of folks that you call regularly to ask, hey, how are you doing? Do you have what you need? Are you feeling okay? If you're not feeling okay, I can help, I can do something online to try to get you some information. A lot of our older adults, the message has been they've really got to stay in the house, and that's hard. A lot of folks are very independent, and so there can be issues around like just needing to talk to someone. And so I think there's lots of ways we can stand up and support one another in this moment. And I think, anyone who's out there, there's a number of things that they can look to.
I wanted to just add, I think there are so many So there's the digital and virtual ways that you can support. But to Candace's point, there are so many creative ways that people have engaged with us. So whether it's been valet company that we've used in the past for events who have been delivering products for us to some of our partners, or a school bus company that has been doing that. You know, these are doing this for free, or our transportation partner called Schlepp, they have done deliveries for free. Everyone has something that they can provide, and they have found creative ways to be able to do that in this circumstance. And so I think if people can think about the things in their lives that they can offer, they can usually find a way to have it make a difference.
Well, thank you. This has been very informational, inspiring, and definitely challenging too, because I feel like it's a challenge to me and to everyone who's listening. Let's find a way that we can pitch in and to help. So thank you so much for spending some time with us. Thank you to all of you who are watching. Shoshana Buchholz-Miller, Kate Maehr, Candace Moore, and all of you. Have a wonderful evening.
Thank you.
Thank you.
Thank you.